Hello, everyone. Happy Sunday, and welcome back to another Sleephoria mini webinar. I'm Dr. Val Cacho, an integrative sleep medicine physician and women's sleep expert, here today to discuss holistic treatments to help with insomnia for women in midlife. So, if you're watching this video, if it's your first time here, welcome, welcome, welcome. We have a lot of videos for women about sleep health, and this is a very, very, very commonly asked question. Hey, doc, what can I take to go to sleep? And my first initial thought is to say, well, why do you feel like you have to take something to go to sleep? And I get it. We've sort of been acculturated, doctrinated since sort of our youth. You have an owie, you put a band-aid. If you're feeling sick, take a medication or something over the counter. Why not? Same thing for sleep. Sleep is tricky. It's fascinating in so many ways. There's so many biological processes in our body and our brain that control our sleep. But what I would like to encourage you and let you know is that if you tried a bunch of things and you still can't sleep well, there is still hope because there are things that you can do. There's things that you can learn to improve your sleep. And how do I know this? Well, I'm a medical sleep doctor and I've been doing this for over 10 years now. I think close to 12 years. So yeah, let's get started. What is insomnia? Well, it's difficulty falling asleep or staying asleep. And if it happens more than 3 times a week, we say that's insomnia. And it's chronic if it's been going on longer than 3 months. Why do women around midlife, around perimenopause and menopause have a lot of sleep disruptions? Some of the rates are 40 to 60%, which is pretty darn high. And it really just gets me and sort of why I'm here, because I want to provide really high quality education. And yes, this is just education. It's not medical advice. I can't treat you over the internet. I am licensed in California and Hawaii. And if you're in those states, you can certainly come see me. Otherwise, watch these videos and hopefully you'll get some really good benefits from it. So why are rates of insomnia higher as women go through the change? Well, we are getting older. And as you get older, there are certain health problems that can start to pop up. Those can disrupt your sleep. Medications that you're given to treat some of those health problems can also disrupt your sleep. And the biggest that I found for a lot of folks are beta blockers for high blood pressure or palpitations. It can make you feel really, really sleepy. As we go through the hormonal changes, it can really affect our mood. And some of the depressant medications can also affect your sleep quality, either cause insomnia or make you feel really sleepy. And sometimes I wish there were more rhyme or reason for which causes which. I'm told by some of my psychiatry friends that Wellbutrin is most energy neutral. But with that said, it just depends. And I always encourage people to be their own detectives, right? What symptoms are you having? Write them down and then correlate that with any changes you're doing and how does that impact your sleep. I'm not a big tracking person, to be honest. I actually just started wearing a Fitbit, not sponsored by Fitbit at all, because I want to track my steps. I was using pedometers and I always would lose them or they would break. It does have a sleep option where I'm not too jazzed about the data that I'm seeing from it because, most things aside, I think I sleep pretty well. And sometimes it tells me that my deep sleep or I'm like up for an hour and I'm like, I don't really think that is true. So putting that aside, sleep trackers, I probably have another videos about that. So should you track your sleep if you're someone who has insomnia? I would say if it's helpful, yes, what you can do with information. But if you start to track too much and you start to second guess yourself, now put that to aside. Okay, so what are the treatments, holistic treatments? Let's get to the nitty gritty of our talk today. So basic treatments, if you go to see, say, a regular doctor, a non-integrative, I've been doing this for so long, I sometimes I forget where that line is drawn, but I would say typical doctors or nurse practitioners or physician assistants who see someone with a sleeping problem will either give them a sleeping pill or if they have signs and symptoms of sleep apnea, order a sleep test. Maybe they'll recommend melatonin, maybe they'll do some blood work, but that's typically it. Treatments as women go through the hormonal changes, hormone replacement therapy, or hormonal therapy. If you've already gone through menopause, certainly that can help. Specifically progesterone. A lot of women have told me that they feel so much better on progesterone. I would say in my medical practice, I see more of the more severe cases. So women who already tried sleeping pills or already tried hormone therapy and still can't sleep. What can they do? Some have even tried cognitive therapy for insomnia, which is sort of the mainstay of therapy. And it basically, the way I like to describe it, it teaches you how to sleep again. What I think is really important is to do the cognitive restructuring, the specific thoughts in and around sleep. Sometimes when people do cognitive therapy, they really focus on sleep restriction, making sure you're not in bed for too long if you're awake, getting out of bed, and then lifestyle habits, which is really, really, really important. But the cognitive restructuring is super key. And then layering on top of that, the holistic treatments, what I'm getting to now, are mindfulness-based therapies for insomnia. So learning about mindfulness, actually some of the research has shown that it can improve insomnia symptoms, depression and fatigue severity. Well, why does it do that, or how does it do that? When you're mindful, you're more aware of your present moment. And I think really what it comes down to is you tend to judge yourself less. You're noticing what it's there. You have this beginner's mind. If you take a look at any of the books by Dr. John Kabat-Zinn, there's a whole list of principles of mindfulness, and some of them are just noticing your attention and your attitude in the moment, which is I think super beneficial. People that I work with who've had pretty severe insomnia, it really starts to consume themselves, and then they tend to have a really harsh sentiment, a really harsh identity, where they feel like they're never going to be able to sleep, that sleep is going to ruin them, that they're aging faster. And then when they read things online, they sort of see a lot of negative information out there and they feel like there's no hope. So if that's you, please stop reading that information. Try to find the happy stories, because there are a lot of happy stories, and maybe we need to create more happy stories and share our stories in and around that. But yeah, it's noticing, being mindful of your thoughts, watching your thoughts in and around sleep. And one of the best ways to start is actually just writing down your thoughts. Are there limiting thoughts about sleep? Sometimes people don't necessarily have negative thoughts, and it's just like random thoughts, and the brain just wants to run, 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 run. I heard this on a podcast, and it's like, I teach this to my patients. Can you park a car going 70 miles an hour, right? And if it's analogous to going to sleep, is parking a car. But if the motor is still running, well, how do we downshift? How do we hit the brakes throughout the day, so at nighttime we're able to fall asleep? And so learning about mindfulness is really helpful. Another holistic tool that you can use is yoga. I remember early in my practice when I was talking to someone about improving their sleep, and I was like, well, sleeping pills can only do so much. And they were like, and I was talking about yoga, and they're like, well, all the yoga in the world isn't going to do anything to improve my sleep. And I'm like, well, have you even tried it? Do you even know what yoga is? And there actually are some pretty good studies on it. One study they looked at, they actually used actigraphy. So people were trained how to do yoga. They were doing it on their own, I think an hour and a half a week for 14 weeks, and actually improved their Pittsburgh Sleep Quality Index. And it was really cool. They also did the actigraphy, right? So trying to figure out if you're awake or asleep based on movement, and there were less arousals on that. So yeah, pretty cool. Some of the research shows that potentially how yoga can improve sleep quality is that it can increase GABA, which is a neurotransmitter that helps modulate our sleep, decrease cortisol, right? The stress hormone also can regulate our blood sugars, increase melatonin. Melatonin is an actual hormone that gets released in response to darkness that can help control our sleep stages. And also randomized controlled trials show yoga can improve anxiety. And, we have this hyper aroused state if we can't go to sleep. And if we can help lower our levels of anxiety, it can really help. So definitely a big plug for yoga. I love yoga. I think it's so helpful. And it's not, I would say, it's easy to get access to it. If you're in a country that has YouTube, just go on YouTube. There's a lot of studios. There's a lot of apps, even free apps that you can download. So it's pretty awesome. Another holistic tool, and this is something that I like to use in my own clinical practice, is clinical hypnotherapy. So I didn't look up the exact studies for this. There are some, and the thing about clinical hypnotherapy, Sometimes people don't quite understand what it is. They think of like stage hypnosis, where someone's, clucking like a chicken or dancing really funny. And that's sort of the entertainment side. But really, clinical hypnotherapy is you're helping someone go into a trance, which is a focused, heightened state of awareness. I like to think of it, my kids are watching a show and they're so fixated, and I'm like, hey, you need some water. I know to say my daughter's name like three times before she's like, yeah. It's not like she's not necessarily ignoring me. It's just that her attention is so focused on that. So once someone is in trance in a heightened state of awareness, then you add basically post hypnotic suggestions, which is post positive psychology. You're a great sleeper. You can sleep anytime you want. Once your head hits the pillow, you can fall asleep and stay asleep. You're waking up refreshed. And it really just creates new neural pathways to almost from a subconscious real level is to tell yourself that you can in fact sleep. And then, when I do it with my patients, we record it and I encourage them to listen to it over and over and over and over again. And it really works. It sounds maybe a little bit silly, but it's awesome. And I've had some wonderful stories from patients who have been able to cure their insomnia by learning about clinical hypnotherapy. You just train the unconscious mind that you actually can in fact sleep. Along that same vein is self compassion. So, self compassion has three components. It's really being kind to ourselves, loving ourselves. We tend to be so harsh, especially if we can't sleep. Our mood can go, and, when you're cranky, and, certainly I know what that feels like. But it's learning really to be kind to ourselves. It also has another component of mindfulness meditation, which is super key. And common humanity. What you're going through, you are not alone. And so some of the research does suggest that self compassion has been linked to less bedtime procrastination, right? And I think of that bedtime procrastination is you're so busy all day long. For a lot of women, we're going to work, taking care of our family and our kids and our spouses and maybe even our parents. We're doing all the things for everybody. And by the time it's, bedtime, we don't have enough time for ourselves. So then, maybe we watch shows or, dramas. A lot of people are really into Korean dramas or, watch things on YouTube or listening to podcasts. And then, those can be so addicting and it really cuts into your sleep. But learning to be kind to yourself. And I think really that self love component and saying, when I do get better sleep, it's better for my mood. I'm more present for my kids. My brain works better so I can function better at work. It does result in better sleep quality. There's a great book or even a program by Kristen Neff all about self-compassion. I think her workbook is called the Mindful Self-Compassion Workbook, and I recommend it to some of my patients who have insomnia, and they've gone through it, and it helps tremendously. Yeah, so some of the holistic modalities, there's so many. I didn't even talk about supplements, but I'll probably share that for another video. My favorites are mindfulness-based therapy for insomnia, which teaches someone about mindfulness principles on top of cognitive behavioral therapy. There's yoga, which I'm just a big fan of yoga. And I think probably my next career, I'm going to be a yoga teacher. I would love that. And then self-compassion training, and then also clinical hypnotherapy. Those are my top recommended tools to help someone improve their insomnia as they go through midlife. Hope you found this video helpful. And until next time, sleep well, ladies. Thank you so much. Bye-bye.